region. So I'm going to look at the top of the shoulder as well. We obtained your measurements the last time you were here, so I'm just going to retest a couple areas so that we can compare, see if there's any deviation from the last time. So from top of the shoulder to elbow, we're about 12.5 on the right side. And symmetrical to the left. Good. Feel one more here. Let's see. There it is. Okay. Good. All right, so I'm just going to cleanse my hands and then we can go ahead and get started. Of course, I'm going to do just a bit of a visual assessment. So look to see if there's anything I'm noting with your posture that looks like it could be off. All right, so just want you to sit in your regular kind of natural posture. So I'm just going to start by having a look here. So just looking at the shoulder alignment in comparison to the clavicle there. Okay, so I'm just going to come behind you and have a look. Is it okay if I move your hair a little bit? Okay. All right, so I'm just going to have a look here, and I do notice a slight misalignment at the shoulder. So it looks like your left shoulder is very slightly lower than the right side. And nothing at the hips though, so hip placement is okay. All right, so that looks good. All right, so I want you to perform a couple of motions for me so that I can see if there's any discomfort with movement. So can you bring your head and neck back here towards me? Is that painful at all? Any discomfort there? And if you go the opposite way down towards your chest, any discomfort here at the spine? No. No. Okay, good. So if you kind of just bring your upper half over, any pain there at the lower back?
No, it just feels like a stretch.
Okay, and on the other side as well?
Same right there.
Okay. And then I'm going to have you hinge forward at the waist, so just fold into your waist. Any pain or discomfort there?
A little bit like
A little bit at the lower back. Okay, so some pain with extension. Then I'm going to support you here. I want you to lean back towards me. Is that painful there?
No, it's like the same area.
The same. Okay, all right. Okay. Any pain upon palpation as I touch it? It's not sore at all? No. No, good. Okay. All right. Okay, so just outwardly, I'm not noting any like egregious misalignment. It doesn't appear as if you're really wasted to one side or the other. I do see just a little bit of displacement here at the shoulder, which is something we can address, but overall, it's not anything that looks very, very concerning. So I'm going to do some manipulation with your arm here. Any pain anywhere as I move you around here? No. No. Okay. And if we bring your arm back, no pain there? Good. Okay. All right. And then same thing on this side, just some movement here, no pain anywhere? No. Good. And then I want you to bring your shoulders back for me. So kind of as if you're squeezing something between your shoulder blades. Does that hurt at all? No. Okay, good. And then if we do the opposite and squeeze at the breastbone, no pain there? No. Very good. Okay, all right. So what I'm going to do now is a bit of a posture assessment. I want to see if this lowering on the left side is just related to your posture. So I'm going to have you sit up straight for me. So did hear just a slight cracking there. Does that cause any pain to your lower back at all? No, good. Okay. All right, so your active posture is actually very well intact. Your shoulders are aligned at the scapula, and that lowering does diminish slightly there. So I think what's happening is just your natural relaxed posture is just a little bit slumped, and you tend to lean over to the left. So it doesn't look like there's anything concerning. When you're sitting upright like this, your shoulders are aligned, so that's fine. All right, so just gonna come behind you with my pen light here. So having a bit of a better look at the external skin. Now the reason for this is that sometimes I can see lumps or bumps underneath the surface of the skin, specifically along the bony prominence, and that will allow me to see if there's any issue that I missed with my initial inspection. So just like to shine my light at an angle and not noting anything along the scapular region. Look at the top of the shoulder as well. Very good there. So now having a look at the back of the neck and spine. Okay, so I'm just going to feel along with my fingers as I do this, and you let me know if any of this is painful or uncomfortable. Feeling anything specific here. Okay. Painful there at all? No. Good. Okay. All right. Just having a look here. Okay, so all of that honestly looks very good. Okay. All right, so I think what I'm going to do is just do a bit of a palpation assessment. So obviously you're familiar with this as we've done it before. So you're just going to feel my hands kind of gently at first, feel around. So mostly doing some pain isolation at this point. So I kind of squeeze and manipulate here. Is there any pain or discomfort there? No. And nothing at the shoulder? No. Good. And if I come down at the shoulder blade, nothing here. And directly along the spine, nothing here.
Not up top.
And as I come lower,
It's like right there.
right there. Okay. Okay, and if I come out, anything here? No. Okay, so about right here is where majority of the pain is. Okay, so I'm just gonna adjust this upwards there. Perfect. Okay. So I'm gonna do some percussion, and this is gonna help me isolate the specific area here. So I'm just gonna feel a gentle tapping with my Reflex Hammer, okay? Does that hurt there at all?
No.
Here?
A little bit.
A little bit, okay. And nothing over here. And nothing up higher at all.
No.
A little bit here.
Yeah.
Yeah. Okay. All right. Okay. So I'm going to have you take a deep, deep breath in for me. Good. And go ahead and relax. Very good. Okay. So that is even. So I think that your issue is definitely going to be overuse of the area. So because you are on your feet majority of the day while you're at work, and you're also bending, lifting, you know, a significant amount of weight, 40, 50 pounds is quite a bit, especially for someone of your stature. So it is looking to me as if we just have like a strain of the muscle here at the lower back. So I would say that we definitely need to work on your body mechanics and practice lifting safely. So you always always want to bend at the knee when you're lifting something. So you never want to just have locked knees and then bend over and hinge at the hip, because that can definitely put a strain on your lower back. I would also recommend pointing your feet slightly outward. That'll give you just a little bit more stability there. And then of course, sometimes what we tend to do when we're picking something up that's rather heavy is we bring our shoulders up to our ears because it feels more stable, but really what you're doing is putting the strain on your neck. So you want to keep your shoulders down and loose. So think shoulders towards your belly button, pull your shoulders down when you're lifting, okay? All right. So just feeling along the spine, I want to see if there's any bulging or deviation that I'm noticing there. I'm going to have you lean forward for me just slightly. Perfect. So just feeling here. Kind of one area at a time. It's just going to help me isolate the discs of your back. So I have a smaller reflex hammer here. You don't have to tell me if this is painful at all. I'm just listening for any obvious differences. Okay. A little bit of hollowness here. Okay, you can go ahead and relax for now. So I'm going to test with my thermometer gun. Now the reason for this is that it just allows me to see if there are any areas of inflammation. So for example, if I test here and I get an abnormal reading, it could mean that there's an underlying infection or some sort of swelling underneath the surface of the skin. So I'm going to use this to test the areas that are more prone to muscle strain. So testing around the shoulder, also feeling with my hand for any possible temperature difference. So you are a little bit warmer at the center of the back. But so far nothing is reading above the normal range. Here in the affected area, I'm also getting a normal temperature reading. So that is all very good news. Not seeing any signs of inflammation underneath the skin. Okay. So let's go ahead and just going to take a quick measurement here. So we obtained your measurements the last time you were here. So I'm just going to retest a couple areas so that we can compare, see if there's any deviation from the last time. So from top of the shoulder to elbow, we're about 12.5 on the right side. And symmetrical to the left. So I'm just going to start at the clavicle here. About 17 inches down at the waist there. Okay. Even on that side, which is very good. Okay, so your measurements look okay. That's good news. So having a look here at your scapular indentation. So again, I'm going to have you sit upright for me. Very good. So you're just going to feel a flat surface. This just allows me to push in at the musculature so that I can better see the bone structure here. So Thank you very much. Okay, so you're going to feel a very cold object. Just using my calipers to measure here. Good. Okay, so not noting any swelling there. Same on this side. Good. Okay. So I'm going to have you do the same thing before where you try to squeeze your shoulder blades together. Okay, very good. Go ahead and relax. So that is great. Very good symmetry there at the spine. All right. So I'm just going to measure here the rib cage. One side to the other, looking for any asymmetry at the waist. Not notable there. About how tall are you again, Samantha?
About 5'4".
About 5'4", okay. All right, so your height is fairly symmetrical with your torso versus your legs. It looks like you're about even, so I'm not seeing any reason why you would be overcompensating. Some of my patients with a longer leg, shorter torso ratio can have some lower back pain, but you're about centered there, so that's very good. All right. Okay. All right, Samantha. So what I'd like to do now is adjust things just a little bit. I want to have you lay face down for me so that I can have a look at the neck, the back of your neck and spine area. So I'm going to adjust the table just a little bit. I'll have you lay down and then we'll kind of reassess in a different position. Okay? All right, Samantha, are you comfortable in the position that you're in? Mm-hmm. Okay. So we're going to get started with the secondary assessment. Now, just having you in this position is going to allow me to look closer at the back itself. Now, obviously the pain is isolated to the lower back. However, I just want to make sure that we're not missing anything. So I'm going to start by feeling around here initially. Okay. So you are fairly toned back here. Your back muscles are intact, and I do see some toning of the back here. So it does appear as if you work out, which is good because it'll give you a bit of a more structurally sound base when you're kind of lifting and pulling. Now I am feeling just a little bit of heat coming off of the midsection of your back. Okay, let me just check that here. 91, so not too bad. But it is just a little bit warmer than the shoulder. Okay. No distension here at the actual spinal column, which is good. So I'm not feeling any particular distension at the spine, which is good news. Okay. So I'm going to feel a vibratory sensation. I'm just testing your bone conduction here. Looking for any radiation that could be abnormal, but so far it looks okay. directly along the spine, this might tickle just a little bit. Good. Good. So that looks so great. Okay, so just doing some pinching of the fattier areas, looking for any abnormalities in skin texture or skin elasticity. Looks okay. Okay, so that looks pretty good. So I'm going to use this little cap to feel around at the spine. Now it has some little ridges on it that help me feel underneath the skin. If you have any nodules or anything on your spine itself, this will just kind of allow me to isolate that sensation. So just going to feel up here at the top of the neck as well. Looking for any signs of swelling. Just using this ruler to test for symmetry of the spine. Alright, so what I'm going to do, Samantha, is just do some very brief, kind of gentle adjustments here that I think will help alleviate some of the pressure. So I want you to just relax for me. So just relax your muscles, relax your shoulders, and just kind of breathe into the table. So I'm going to start here at the head. So you're just going to feel my hands, doing some gentle rotation to start with to kind of introduce the sensation, and then you're going to feel a light tugging, okay? Good. So I did here just a little pop there. We're going to do that again, this time lower down. And good. Good. So feeling a little bit of release there, nothing too crazy, but same thing at the shoulder. I want you to take a breath in for me. And exhale all the way through your diaphragm. Good. And again, you're going to take a breath in for me. And exhale all the way through. Good. So felt that a little bit more on the left than the right. Doing some gentle compression here. going to stand up and come down towards your lower back and do a bit of manipulation there. So, all right, so coming here down more towards the isolated area of pain. I'm just going to tuck your shorts in here. Good. Okay, so I definitely am feeling some warmth here. So what I'm going to do is some gentle manipulation with my acupressure tool. Now you might feel some pressure at first. Is this causing you any discomfort?
No, I'm feeling a little bit of relief.
Okay, good. So essentially what this does is pushes out any excess inflammation and fluid from the area to help encourage a rise of blood flow and then a release of pressure. So just doing some targeted movements here. Just doing some targeted movements here. We'll do that on both sides, and then when I go to do a manipulation, it'll give us a little bit more leeway to really work into the musculature. So very good. And just gonna go down and decompress the spine. And then we're gonna do a bit of firmer pressure gua sha here, away out from the spine. We'll see a little pinkening of the skin, which is normal, it's just friction. Okay. All right, so I want you to breathe in very, very deeply for me. Good, go ahead and release all the way. Good, so I definitely felt some relief here, so I'm gonna, good, good, feel one more here. Let's see, there it is, okay, good. Good. Okay. Just gonna do some stretching here. Okay. And breathe in for me. And all the way out. Good, very good release there. So you should probably start feeling a little bit of relief. We did quite a bit of adjustment here at the lower back. Okay. Yeah, that's a lot looser there. Okay. All right, very good. Okay, Samantha, so I'm gonna have you sit back up on the table and we can kind of reassess, okay?
Okay.
All right. All right, Samantha, so what I would say really is that I don't have any bad news for you. So there was nothing I noticed that was particularly abnormal. There's no need for any sort of corrective procedure. I did do several adjustments that weren't quite expected. So you did have some tightness at the shoulder, specifically at the top, so just below your neck and then right at the scapula. And then we had the biggest adjustment at the lower back, which of course is where you're experiencing most of the pain. So you might feel just a little bit sore. Sometimes it can make you feel tense. And then as the day goes on and you kind of relax a little bit, your muscles will relax from the contraction, and then you should feel some relief of the pain. Okay. So I'm just going to notate that we did those adjustments and your measurements were all fine. Everything is perfectly symmetrical. There's no issues where one side is kind of looking different than the other, which is really good. So the biggest thing that I'm going to recommend moving forward is that you change your footwear. So I know that it's kind of difficult because we get used to wearing the shoes that we're most comfortable in, but it really is the shoes that you wear on a daily basis aren't necessarily the shoes that you should be wearing to work, and vice versa, because you want your foot to be able to adapt to the situation that you're in at the time. So would definitely recommend looking into something with more sole support, and then something that's not so flat-footed. Okay? All right. Okay. Well, I am going to go ahead and transfer these notes over electronically into the computer. That way we have everything documented accordingly. Would maybe recommend following up with a chiropractic specialist. So obviously I did some adjustments in-house today, but if you went to a chiropractor, they could really do like a full head to toe adjustment and then do some micro movements and see really where the pain is isolated to. Okay, so I can give you some recommendations if you don't already have a family chiropractor. Okay, so I will go ahead and put all of those in. I'll give you 3-4 different options in your area and then go ahead and reach out to them. Okay. I would say if the pain is persistent, even with you seeing a chiropractic specialist, I would maybe come back. We might want to look into something like an MRI so we can have a look at your spine and see if there's any deviation happening.
Sounds good.
Okay, all right. Well, thank you for coming in today. I sincerely hope you start to feel better.